Hello, my name is Mark Arneson. I am the lab manager at Hillcrest Memorial Hospital. I have a bachelor's degree in business and a master's in management, both from Southern Westland out of Central South Carolina. Over the next several minutes, I'm going to talk to you about rounding for outcome. Rounding for outcome can be used by any organization, but in this particular case, I'm going to focus on healthcare organizations. What is rounding for outcome? It's proactively engaging, listening to, and communicating with the most important customers, the family, the patients, employees, physicians, and other departments. The number one reason or action you should want to do rounding, it'll increase patient satisfaction, employee satisfaction, as well as physician satisfaction. Let's start with the end in mind. You should proactively create a one-on-one relationship with each direct report. You want to re-recruit staff by engaging them and listening closely with them. Uh, During the rounding, it can help solve problems, and it also creates a culture of recognition, which many organizations, to be honest, fall a little short on this. Who should round? Obviously, senior leadership should round, as well as middle managers or just managers in particular. Of the senior leadership, who exactly should be the CEO, CNO, CFO, vice presidents, whatever you have in your organization. Why should they round? It sets the tone for rounding in the organization. If you're going to embrace this concept, everybody should be doing it to include the top brass, so to speak. And it supports middle managers, another reason why, by delivering reward and recognition, also by supporting the key messages already delivered by the manager, and it also celebrates achievements. There are three areas of focus that senior leaderships have on their responsibility. Is one is round on their direct reports, of course, and invalidate direct reports are rounding effectively and consistently by leaders who report to them. And also, it's senior leadership should round in departments using a scouting type report. With the middle managers, you should round with all your direct reports. One of the reasons you should do this, it builds relationship, it harvests wins, it focuses on the positive, it helps with process improvement as well as safety. Some of the questions that are asked in rounding that we use are, what is working well? Are there any individuals whom you want to recognize? Are there any physicians you want to recognize? What systems can we do that we use could be work better, use or can be working better? And do we have the tools and equipment, or do you have the tools and equipment to do your job? Why should you round? Well, what most employees want, they want a good supervisor, they want effective work systems, they want the tools and the equipment to do their job, and they want to be appreciated. There's some statistics out there, and most of them, around about 60% of all employees who leave a position do so because their relationship with their direct supervisor, not the work, their direct supervisor. So rounding can help in this. Some tips when you're rounding, you want to explain what you're doing. You want to get comfortable. You want them to be comfortable, and you also want to be comfortable in saying, "I don't know the answer," because supervisors don't always know. Managers don't. You want to communicate actions taken, so when you're talking, that later on you can come back and say, "These are some of the things we did, and this is why we did it because of rounding." You want to drill down to identify specifics. You want to get what the nuts and bolts of what is going on, what's going right, what's not going so well. Some of parameters, all leaders will round on their direct reports. I've mentioned that already. You want to round on 100% of them. You want to do so monthly. You want to document this because each month your senior leadership or your supervisors should be rounding with you, and they should be checking your logs. How often should you round on staff? On an average, really should be 2 a day. Somewhere around, each staff member about 7 to 10 minutes. So you're looking roughly about 15 to 20 minutes a day, and maybe 10 minutes to follow up. So you're looking at about 30 minutes a day, and that's it. For most leaders, this will equate to rounding on each staff on a monthly basis. In reality, if you have like 41 to 80 employees, you'll probably do this every 2 months. And if you have more than 80, you'll probably really round with staff every quarter. Rounding log documentation, some notes. You should note on the documentation staff and physicians that were recognized, systems that needed improvement, tools and equipment to do their job, and you should ask a tough question. Um, Always ask a tough question. I mean, you want to know what the employees are going through their mind, and if you can develop one every month, you can kind of get some positive and some enlightenment during these tough questions. Um, should we round with physicians? Of course, we should round with physicians. This will increase with is shown to increase quality, efficiency, and their voice in the operation. And you also want to recognize them as well. And to be honest, you should tell them when they're being recognized by the employees that you have. Um, Other things you should do are 5 good reasons you should round. Increases individual productivity. It increases engagement among the colleagues. It creates a higher likelihood of staying with the organization. You invest a lot of money on people, so you really want to keep them in the organization. It creates a higher loyalty and satisfactions with scores with the customers. And lastly, it's a better safety records and fewer accidents are shown just by using this rounding. Some other tips: you start from the top. You want to connect to with a purpose. You want to put this on your calendar. It adds value with like a win-win-win situation, and it also you want to document so you know how many you've actually done. And don't let the tough guy tell you it doesn't work, because this rounding we've been doing it in our organization for over 3 years. I will attest that my satisfaction scores have gone up every year since we've been doing this. Um, don't be secretive about what you're doing. You want to build it into the culture so every employee knows what's going on. Over the last several minutes, I've talked to you about rounding. I hope this was beneficial to you. Like I said, we've had this in our organization for several years now and has proven to be very effective. I appreciate your time. Again, my name is Mark Arneson. I hope you have a wonderful day. Thank you.